So what is a continuous glucose monitor? The one that we just placed. As the name implies, it's continuous monitoring of glucose. But remember, it's not blood glucose, it's actually sensor glucose. So now Katrina is going to tell us the sensor that she placed and what is exactly that going to sense.
So you guys just saw me place my sensor into my arm, painless. And now this is just a visual depiction of what's actually going on. So here we have the CGM sensor that's laying on my skin. This is the transmitter.
The white color is a transmitter.
And the sensor is this filament that's placed into the skin. We use the needle, but the needle's no longer in my skin anymore. And it goes through the skin into the subcutaneous fat where it's picking up interstitial fluid glucose. This means that the blood vessels and capillaries are very, very tiny blood vessels, are releasing glucose into the fluid, and this sensor will pick up on that fluid glucose.
That's why it's called sensor glucose and not blood glucose. So now if you take a look at this graph, it's a very common graph that we use to explain what is the difference between BG, that's blood glucose, versus SG, that is sensor glucose. Imagine if you were riding a train and there were two bogies here. In the blood, like your actual real-time glucose level, when you check it on fingerstick, is very close to what your blood glucose is at that real time. Very shortly, in few seconds, is the sensor glucose. So there is a delayed or a lag phase between what a sensor glucose is, that is the one coming from the interstitial fluid, versus blood glucose. Hence, they are not 100% accurate, but their mean relative or accuracy relative difference is very, very slight. As you see, there is a vast difference here. Blood glucose is 150 and the sensor glucose is 124. It can happen. But as we start using the sensor more often, 24 hours later, we tend to get more accurate readings over time and over days. Last piece is, what are these sensor glucose or continuous glucose monitoring readings really helping you with? It's not just one-time reading, right? It's continuous. So every 3 to 4 minutes or 3 to 5 minutes, you're getting lots of readings and they generate a pattern, a wave pattern, just like your EKG. So if you take a look here, this is the actual printout of what you're going to literally review as a wave pattern. And that tells us if your blood sugar is going up high, low. There are variations from 0 to almost 400 that it can capture. You're able to see time-based readings. So this basically is 12 a.m. until 12 a.m. So 24-hour readings, time 10 days, 14 days, or 15 days. So your patterns are what's very, very useful in continuous glucose monitoring.